Today, let's talk about a piece of tech that is completely changing the game when it comes to seeing inside our own bodies. We're going to take a journey into the world of video capsule endoscopy.
I mean, seriously? What if you could figure out what's going on inside you just by swallowing a pill? It sounds like pure science fiction, right? Well, what once felt futuristic is now a powerful reality in medicine, and it's totally reshaping how doctors look at gastrointestinal health. Okay, so why is this technology such a big deal? To really get it, we first have to understand the problem, the diagnostic dilemma this whole thing was created to solve. You know, the old school way? That involves a pretty invasive procedure with a long tube and you're often sedated for it. It works, for sure, but it can be really uncomfortable, and honestly, it can't even reach everywhere, especially deep inside the small intestine. But this capsule? You just swallow it. That's it. No sedation, and it gives doctors this amazing, comprehensive view of places that were super hard to see before.
So what's the incredible solution to that problem? Well, it's literally a camera you can swallow.
All right, so this is what we're talking about. Video capsule endoscopy, or VCE for short. It's basically a camera about the size of a big vitamin that you just swallow. As it takes this natural journey through your digestive system, it's wirelessly sending back thousands of super high-quality pictures. It's creating a whole video of your insides. And honestly, this is the perfect way to think about it. It's like strapping a GoPro onto your digestive system. It's this tiny camera on a mission just silently recording its journey and sending back this incredible footage for the doctors to check out.
And for the person actually going through it, the patient, it could not be simpler. Seriously, step 1, you swallow the capsule. Then you just go about your day. While you're at work or just chilling at home, this little capsule is doing all the hard work. And later, your doctor just downloads all that data for a complete visual record. It's just a brilliant mix of high-tech medicine and patient convenience.
So why is this a game changer? Well, first off, it's minimally invasive. That is a huge win for patient comfort. Plus, it can get into parts of the small intestine that are just notoriously difficult to reach with other tools. And because of that, it has incredible clinical power. It's super effective at finding things like the source of hidden bleeding or spotting the signs of conditions like Crohn's disease.
But, you know, the innovation doesn't just stop with a tiny camera. The next big leap is all about making the diagnosis part faster and way smarter. And how do you do that? You bring in artificial intelligence.
I mean, just think about this for a second. A single one of these procedures generates thousands of individual images. The challenge for a doctor is having to manually go through hours and hours of footage, looking for just a few critical frames that show something is wrong. It takes forever. And you know, it's easy to get tired and maybe miss something. And this is where AI just completely changes the game. Instead of that slow frame-by-frame review, an AI system can scan the entire video in a tiny fraction of the time. It's been trained to flag any suspicious areas, potential signs of bleeding or inflammation, which lets the doctor focus their expert eye exactly where it's needed most. It is a massive leap in both efficiency and accuracy.
I absolutely love this analogy. It's just perfect. The AI isn't the director. The doctor is still in charge. The AI is like a seasoned film editor, instantly pointing out all the important scenes so the director can make that final critical call. It's really the perfect partnership between human expertise and machine intelligence. Okay, so we've gone from a passive camera to a smart camera. But what if we could take it even farther? What if doctors could actually take the wheel? The next evolutionary moves us from a capsule that just floats along to one that they can actively drive.
Yeah, this is the next big thing. Using external magnets, doctors can now pilot the capsule in real time with something that's basically a joystick. They can steer it, they can turn it around, hold it in one spot to get a much better look at specific areas inside the stomach. This allows for a way more thorough and targeted exam than was ever possible before.
And the results? They are just astounding. In early studies, doctors using these steerable capsules were able to see almost 95% of the entire stomach. That number, that represents an absolutely incredible level of diagnostic precision, one that rivals the old methods, but without that invasive tube.
A great example of this in the real world is the NaviCam system. It gives doctors that precise control, and for patients, it often means they can skip sedation altogether. And you know what else? Early studies are showing that patients strongly prefer it. When they're given the choice, most people would much rather swallow a controllable capsule than go through a traditional endoscopy.
This tech is already incredible, right? But believe it or not, this is really just the beginning. So what does the future of digestion look like when we move beyond just diagnosis?
Oh, the roadmap for this is so exciting. We're talking about things like embedding even better sensors and AI right onto the capsule itself. But the real paradigm shift, moving beyond just seeing the problem. Future versions might actually be able to perform precision therapies, like delivering medicine directly to an inflamed spot or a tumor. The capsule could go from simply finding the problem to helping treat it.
Just think about that for a moment. That whole journey, from a simple camera you swallow to an AI-powered, steerable device that might one day deliver targeted treatment. This technology isn't just some clever gadget. It is a powerful glimpse into the future of personalized medicine, a future where diagnosis and therapy become way more precise, way less invasive, and just more effective for all of us.